Okay, everybody, we start our live here. Then you will see later if you won't record it. We will talk about a different topic. It's a very important topic. Today is, we call that the clinical cases in T.M.J symposium. Clinical cases T.M.J symposium. Don't miss it. It's a very nice topic, and I want to introduce the topic first, and then we will start to see the PowerPoint. T.M.J is a temporomandibular joint. Temporomandibular joint is a start, very famous joint. Everybody know that kind of joint, and I want to show you two patients that have a lot of problems with the dysfunction of the craniofacial system and the temporomandibular joint. Let me share the PowerPoint. Clinical cases. So we see some clinical cases, two patients. We will see two patients, and if you like some topics like this, please leave the comments in our channel, and you will and I try to develop different topics in our YouTube channel. All right. As I told you before, temporomandibular joint is a very, very famous joint. It's a joint very, very, very famous. We have, I think, it's most of the famous joints in our body. Yeah? The temporomandibular joint, a very, very famous joint. Today I will show two patients, and we will talk about these two patients, how they are creating a lot of problems. The dysfunction of the temporomandibular joint is creating a lot of problem in the body. Remember, it is not TMJs, it's craniofacial dysfunction with the rest of the body. That is the topic. Okay. Clinical cases. We see now our first patient. Yeah, our first patient is a lady, and we do normally in our school a holistic diagnosis. Holistic diagnosis is the goal, in my opinion. The goal is holistic diagnosis. And we study the neuromuscular skeletal pathology. That is, in these cases, is very important to do an holistic diagnosis. Don't forget it. When we are seeing just one part of the body, it is no good. In the neuromuscular skeletal diseases, we have to see the whole body. We carry on means a static craniofacial system and the rest of the body. The negative effect of the craniofacial system through the muscle chains is very well known. Something which is not working here is creating a slowly craniofacial system dysfunction, slowly muscle chain aggression, and we have to understand that, and we have to do holistic diagnosis. For this reason, it is important to study the whole posture, not just the joint, not just one part. That patient have diffuse neuromuscular skeletal symptoms, mainly in the cervical and lumbar area, dizziness and diffuse general fatigue that is aggravated when walking, when he wakes up. He has a lot of difficulty to sleep. And if we observe the posture, we have a triangle who suspect a short leg, can be false, two profiles, the profiles, this angle is where they are different, and the profile we suspect there is three blockades, three different hinges blockades, the cervical, lumbar, and the foot support, and hypoconvergence. Bilateral hypoconvergence is related with the jaw position. And the jaw, we see the occlusion. The occlusion is very bad, retro position, and is creating a lot of problems. And when we observe the posturometer, we say the measure of the alteration. We have here mouse open and mouse closed, 2 reading. As you see here, 0 overload, mouse open, and when it's closing the mouse, it's going to 0.3.8 kilos to the left. And also, if you observe, we see the barycenter is going back and left. Barycenter mode when the patient closes its mouse, and that is very important. We understand the measure is creating science. When you measure, you are science. You have a science. You create your opinion, your clinical opinion, into science. Second patient, and that's very bad. We here talk about chronic pain. When we're talking about chronic pain, that's because we did a very bad treatment. When something is chronic, that is our fault. And we see that patient. We're going ahead. This patient have an oral rehabilitation, very, very old, that create 10 years of suffering. 10 years of suffering. That's very, very sad. 10 years of suffering. That is sad. That is not a good situation. And we carry on. We carry on with this. Here, prosthetic restoration, very bad prosthetic restoration, poor anatomy, poor function, and that's the jaw position, craniomandibular disorder, affecting the cervicals. But not only that, affecting the posture, muscle hyperactivity. We see the neck with hyperactivity, the head in lateral deviation, vertical dimension loss, postural alteration, a lot of things regarding with the occlusion, with the jaw position, hypoconvergence related with the jaw, and that's the rehabilitation. Chronic rehabilitation, very bad situation. If you observe there is not a guide, there is not occlusion, there is nothing working well. But all with ceramic. Ceramic is traumatic, very traumatic. Chronically, in lateral deviation with a very bad restoration, we create, obviously, dysfunction, and we create bruxisms as a defense. Remember always, bruxisms is a defense. Bruxisms is not a stress. Bruxisms is a defense of the central nervous system to protect the joint. Remember always that. And with that situation, is creating the bruxisms to defend the jaw position. Very bad. Bruxisms, defensive bruxisms. Abrading the anterior guide, and chronically, look at here. Perforation of the disc, intra-disc alteration, broken the disc, and we have condylar deformation because we have increasing the jaw pressure. You know, when the pressure is increasing inside the joint, we have absolutely deformation of the jaw, and if it's chronically, we can broken the disc. That's why we have to prevent that situation in our patients. Very, very bad. Deformation, broken the disc, and also again the posturometer recorder. You can see here, mouse open here, mouse closed. Have a look, 3 kilos of overload. Close the mouse is increasing to 8. Overload. And look at here, the barycenter move. Going to here, overloading and barycenter position, back and left. When we have that situation, The posturometer is a good instrument to measure. With the posturometer, we transform the clinical opinion into science. It's an objective instrument. Okay, we finished today. The talk is a little talk about T.M.J and posture, showing two patients, two different patients who suffer because we don't do a very good intervention. All right. Okay, I hope you enjoy it. If you like the video, remember always like the video, subscribe to our channel, and you will be informed on all our topics we are doing in our channel. This is a free channel. If you enjoy it, like the video and subscribe to our channel. Bye bye everybody, until the next transmission in our channel. We do live transmission like this, very short, and also video, a lot of videos in our channel. Bye bye everybody, until the next transmission in our NPR International channel. Bye bye.